How to protect fertility during cervical cancer radiation. How can you protect your fertility during radiation treatment for cervical cancer? This is an important question for many women facing this diagnosis. Radiation therapy is often used to treat cervical cancer, especially when it has spread to the pelvic area. However, this treatment can significantly impact fertility by potentially damaging the ovaries and uterus. Fortunately, there are several strategies available to help preserve fertility. One effective method is ovarian transposition, also known as oophoropexy. This surgical procedure involves moving the ovaries out of the radiation field, usually higher in the abdomen. By doing this, the ovaries are less exposed to direct radiation, which helps maintain their function and fertility potential. It is important to note that while this method can be beneficial, some radiation may still affect the ovaries, and the success of this procedure can depend on various factors, including the patient's age and overall health. Another option is cryopreservation of oocytes or embryos. Before starting radiation, women can undergo ovarian stimulation to produce mature eggs. These eggs can then be harvested and frozen for future use. If sperm is available, embryos can also be frozen. This method is well established and offers a good chance of achieving pregnancy later, especially for younger women. For those who may not have time for ovarian stimulation, ovarian tissue cryopreservation is an experimental but promising approach. This involves removing and freezing ovarian tissue before radiation treatment. After cancer therapy, the tissue can be reimplanted to restore fertility and hormonal function. This method is particularly useful for women who need immediate cancer treatment. Fertility-sparing surgery is another option for early-stage cervical cancer. If the tumor is small, a procedure called radical trachelectomy can be performed. This surgery removes the cervix while preserving the uterus, allowing for the possibility of future pregnancies. It is essential to carefully assess lymph nodes during this surgery and follow up with appropriate treatment, which may include less intensive radiation or chemotherapy. Counseling and multidisciplinary care are crucial throughout this process. Early referral to reproductive endocrinologists and fertility specialists can provide valuable support. Patients should receive thorough counseling about the risks of infertility due to radiation, available preservation options, and realistic outcomes. Each decision should be tailored to the individual, considering factors like cancer stage, age, and personal desires regarding fertility. It is important to understand that even with protective measures, there are limitations. Radiation doses as low as 15 Gray can lead to sterilization, making it vital to protect ovarian tissue. Additionally, even with ovarian transposition, some ovarian failure may still occur due to scatter radiation or age-related sensitivity. Radiation to the uterus can also affect the ability to carry a pregnancy to term, which may lead some women to consider surrogacy. In summary, protecting fertility during cervical cancer radiation involves a combination of surgical options, cryopreservation techniques, and careful planning with healthcare professionals. Early consultation with a multidisciplinary team is essential to create a personalized approach that balances effective cancer treatment with the desire for future fertility. Always consult your healthcare provider to discuss the best options for your specific situation.